Okay, AP Psych class, welcome to second video for Unit 13. We talked about all of the psychological therapies in video 1, and now we're going to do an overall evaluation of their effectiveness. And so the first thing to discuss concerning the evaluation of the psychological therapies is how do we objectively measure whether or not they are effective in helping individuals overcome mental health issues. We have some issues concerning the fact that most clients only report the successes, which makes it hard to objectively measure, and a couple other issues here coming up with objective measurement. We do know this. The more specific the problem is, the greater success you have with psychological therapies, right? An individual that can, pinpoint the reason, for example, why they feel depressed may make it easier for a therapist or a counselor to help them overcome it when it's a specific problem versus just a general dread or malaise may make it very difficult to treat. Some other issues to consider. Eisnick, when doing some research, and then later when we did some meta-analysis, we found that time really is a great healer. First, a statistics term, regression towards the mean. We know that unusual events, right, extremes and highs or lows, will eventually return to an average state. So like, for example, if you got a super high or super low test grade, if you were to be retested, chances are your second score would probably be more towards the average than that first extreme. The same is true with our moods and with our general mental health, right? That these peaks and valleys will eventually return us to an average state. So whatever it is we do, right? We're feeling depressed, we take up exercise or take up a new hobby, go talk to a counselor. It tends to be that we'll go more towards that mean or that average eventually. We tend to just attribute it to whatever it was we did. Like, oh, it must be because of my new yoga class, or it must be because I am seeing a psychiatrist or a psychologist. And so time could really just be the issue there, not necessarily the treatment itself. We do have meta-analysis, if you think back to your 40 studies reading, right, that if we research the outcomes of all these different kinds of therapy, whether it be group therapy and family therapy, behaviorist therapies, cognitive behavioral therapy, humanistic approach, it doesn't matter. What they found is that those not undergoing therapy eventually improve. Again, think regression toward the mean. But those undergoing therapy are more likely to improve and tend to shorten the amount of time that it takes them to improve. And so kind of, think of the, a broken leg analogy. Sure, you could, Rambo, reset that leg yourself and bandage it up and eventually it would heal. But the help of a physician will make the healing process more likely to happen without any side effects and decrease the amount of time it takes you to heal. And so, right, think back to 40 studies, right, Smith and Glass, right, that's what we've learned from the meta-analysis of the therapy treatments. And so which one of them is better than another? The answer is whichever appeals to you, right? That's why therapists take an eclectic approach. Whatever works for you will work in helping you heal more quickly than if you were to try to do it alone. There are a lot of alternative theories out there. And so what we have to do in evaluating alternative therapies is to look at evidence-based practice, right? The best available scientific clinical research out there, right? And patient preferences, like looking at all of that together to see whether or not something is truly effective. There's a lot of things out there, right? Alternative herbal medicines, massage therapy, spiritual healers. But until we have some clinical, proceedings on these, if we approach this with the scientific attitude and not be cynical of these things, but just be skeptical of them, we need more evidence-based practice to determine whether or not these things are as effective as some of the more mainstream psychological therapies. Two in particular that have been looked at a lot and that Myers looks at in your textbook are EMDR and, I'll put the other one up there, light exposure therapies. EMDR, eye movement desensitization and reprocessing, is this concept that darting one's eyes back and forth while you recount a very traumatic experience or encounter a phobia can decrease your reaction to the trauma or to the phobia. And so lots of people claim that this works wonders, that these darting eye movements can really decrease the amount of anxiety they feel as a result of thinking of their phobia or their trauma. But really in clinical research, does it work? Well, I guess, right, in that it's really using the exposure therapies that we've talked about under behaviorism. Like, how do we know that it's not just a result of the fact that people are in a controlled, safe environment confronting what it is they fear? It's probably a combination of exposure therapy and some super big placebo effect that make EMDR work. Kind of similar to when hypnosis was the new big thing in the world of psychological therapies, that one's belief in the process often makes it helpful for that individual. But clinical trials don't show that it's any more effective than other exposure therapies. Light exposure therapy would be what's used for the treatment of SADS, right? That seasonal affective disorder that you learned about in Unit 12. This does, in clinical trials, seem to work. And so, there probably will be a point where light exposure therapy for SADS is not listed as an alternative therapy, but more of a mainstream therapy. That any sort of light box that can replicate that early morning light seems to activate areas of the brain and get them active in making people feel less depressed in those winter months. And so, artificially giving yourself the sunlight that we living in Ohio never seem to get seems to be helpful for people that are affected by that mood disorder. And so there you have it. Look, concerning a conclusion on this evaluation of the therapies, the common ground here is this. Yes, we know that time is the great healer and that, some therapy would be better than no therapy. But, any way you slice it, psychological therapy gives hope to demoralized people. It can often give you a new perspective to have somebody, outside of your circle of friends and family give you advice or treatment. And it allows people to build a trusting relationship with somebody that they know is, there and interested in helping them through rough times. And so that can be, a big help to people. Okay, and so there's your evaluation of the therapies. So come to class and discuss the psychological therapies and their benefits. Thanks for listening.